Okay, so welcome students. So today we're going to take the next class on Materia Medica. So in Materia Medica we've learnt many remedies before, and now we've learned many of the respiratory remedies, we've learnt cough remedies. Today we're going to learn another one, which is Antimonium tartaricum. Now if you remember, we've also studied another remedy called as Antimonium crudum. But there's one thing I told you, all antimony group remedies have. And what is that? All the antimony groups, whether it be antimony crudum, antimony tartaricum, antimony sulfide, all of them have one characteristic mental symptom, which is sulky. Sulkiness. Now the sulkiness you will find in all the antimonium groups. So you don't have to remember, oh, what is antimonium sulf's mental symptom? What is antimonium crude? No, everybody have sulky symptom. Right? That is a common mental symptom in antimonium group. That's number one. Now, when you're talking about sulky, what do you mean by sulky? How will the patient react? Let's say if it's a child. This is the kind of reaction that you find in a sulky mood. If it's an adult, they'll say, oh, my wife is doing like this. She is doing like that. This is all the time they'll express this in your clinic. I'll show you a short video also of how a child will behave in a sulky mood in an antimonium tartaricum physical symptoms. Now, what is the common name? Tartar emetic. What is the meaning of the word emetic? Vomiting. So, tartar emetic, antimonium tartaricum, there is often an emetic property in it, which is vomiting property in it. Remember that one thing. Miasm. What is the miasm in antimonium tartaricum? All remedies have got miasms, but here you will find predominantly soric and psychotic. Why do we call it soric? Because it's usually found in the children, lot of mucus secretions, vomiting, discharges, rattling, all of them comes under the soric characteristics. Psychosis, why? Because of the mental state, the sulkiness that is lying in the background. So you'll never find antimonium tartaricum who's going to die, who's having the symptom of hopelessness, who will say, I'm going to die, I'm going to die. No, that is all syphilitic trait. You'll find that in aurum metallicum. You'll never find that in antimonium tartaricum. So depending on the drug, you can also make a judgment on the miasm. Depending on the miasm, you can also make a judge on the drugs that is more suitable in your case. So antimonium tartaricum will have breathlessness, but he will not talk about death or die. Diathesis, scrofulous diathesis. What does scrofulous mean? Scrofulous means glandular affections. There's a lot of glandular affections as well, but it's not very marked in this remedy. I have not seen in the clinical experience, but it is there as per Hahnemann's Hahnemann's books. Okay. Alchemists call this compound tartar emetic. I'm talking about the chemical composition of tartar emetic, and it was traditionally prescribed as a powerful emetic. So what you call is a crude way of treatment. It was given to a person so that he will vomit in 5-10 minutes. It was called as the prince of evacuants. That's how strong it is, right? So it is caused severe vomiting and was taken to expel what? Intestinal worms. It was given to expel intestinal worms in a crude form. So always keep that in your mind. When we talk about the drug in detail, we'll understand that also. Now, this remedy was proved in various separate trials by Dr. Hahnemann, Staff and Henk, published in Allen's Encyclopedia of Materia Medica. So you want to learn more about this particular remedy, open Allen's Encyclopedia. You will find all the information from Hahnemann, Staff and Henk in that particular remedy. Now what I'm teaching here is the easy way to remember the remedy for your clinicals. You want to learn more, you want to write more in your answers, read more from the book. Traditionally used in the West, which is this particular part, for treating what? Intestinal worms, fungal infections and expectorant, which is basically the allopathic use, if we call it fungal and as an expectorant. So there is a sphere of action that we already know that they've already found out, and we are just taking the homeopathic proving information from it. So remember this. Prepared by combining potassium tartarate with oxide of antimony, which is formed in a reaction of moist air. So remember how this remedy is formed. The chemical properties of this remedy is potassium. What is that potassium? Tartrate. Don't worry about this potassium tartrate. Just remember potassium tartrate plus the antimony component, which gave the sulky mood to this drug. But how did these two things combine? Remember that. It got combined in the moist air. Moist air, what is the meaning of moist air? Air that has got little bit of droplets of water. Where do you find that? In this weather, let's say. When there is rain and the next day it's very cold and you go out for a walk, that's when you feel that. So that is one thing that you have to remember. Second, even in your house you can find that. Where? In your basement. So antimonium tartaricum patients have got aggravation in damp cellars. Based on the way the remedy was formed, you can understand the characteristics in your patient. All antimonium tartaricum patients, an easy way, let's follow the three-legged stool. Easy way to find antimonium tartaricum, one of the legs would be, ask the patient, where are you living? If he says basement, one leg of the stool is ready already for you to prescribe antimonium tart. So how was the remedy formed? Antimonium with potassium tartarate, but how did these two join together? Only in the moist air. That's why moist air aggravation is there in tartaricum. That's why they'll have all the problems. Ailments from damp cellar, ailments from moist air, all of these are ailments from. Okay, so that is antimonium tartaricum. So diseases originating from exposure to damp basements. So you know, when will I give antimonium tart on a physical aspect? One, damp cellars. Through the pneumogastric nerve, pneumogastric, which means something that controls the diaphragm and the gastric part. It depresses the respiratory and the circulation, thus producing the keynote. So what is the keynote? What are they talking about? They're talking about respiration is reduced and circulation is reduced, which means low oxygen levels and decreased respiratory rate. His respiration will not be his respiration sulkiness even in the respiration, right? But in that slowness of the breathing, when he coughs, it will not be like this. It will be gul gul. There will be a lot of phlegm inside. This is where antimonium tart will come into picture. Sulkiness of the mind, sulkiness of the chest, and there will be a rattling in the chest. You already have the three legs present now, but still we need to confirm the remedy more with the patient. Now let's look at this video.
It's good.
This is a homeopathic hospital in India. Okay, let's listen to that video. What I want you to observe in that video is the child is sulky, okay? The cry is also how? Not ah! That is a chamomilla way of crying. What is the way of crying? Ah! Okay? And then in the end of that you'll see and let's listen to that sound of the cough. Gul, gul, gul. That is filled with phlegm. This is the way you'll observe the patient.
It's good. That's the rattling of chest. Okay? So, rattling of chest. This is something you should never forget. They call this as the death rattle. It will feel as if the child does not have any energy. Look at the way she's falling on the bed, like this.
Any child will start doing this, you know, mama, no, 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 don't put me on, carry me. Nothing of that. You leave me, I just fall on the bed. Because the chest does not have the strength to breathe nor to expectorate. No strength to breathe nor to expectorate the phlegm. This is the characteristic of antimonium tartum. By looking at the child, you observe. So how much time does it take to observe? This is an acute case. How much time does it take? That's the time needed. Just ask 3-4 questions to the mother. We already know as an acute case I can take care of this child. Next, very common thing in most of the antimonium group is white coating of the tongue. Let's compare this with antimonium crudum. Antimonium crudum, thick, leathery, white coating of the tongue in the morning, always. That is antimonium crudum. Antimonium tartaricum, white coating with red papillae. You see those red papillae? That will be jutting out like that. The fourth leg that you can add on, observatory symptom. Whenever you are learning a remedy, think of mental symptoms, things that you can observe from the patient, things that you can get from the patient. Because there's never been a case where you get all the three. There may say cases where you get only observatory symptoms, there may cases only physical symptoms. Okay, when the patient coughs, appears to be large collection of the mucus in the bronchi. It seems as much you would have to come up, but nothing comes up. Remember that. What is there? May ask the mother, does she bring it out? Does she vomit out? No. She does that. She tries to, but she's not able to. That is the exact statement from the mother. Sensation as if. Face. So what happens? I told you it depresses the oxygen level. So how will the face be? Pale. Covered with cold sweat. There's another remedy that has got cold sweat. It's called Veratrum album. But why did Veratrum album get cold sweat? Because of diarrhea. Why did Antim tart get thing? Because of the pneumogastric nerve getting affected. As a result, sulky respiration, sulky mind, rattling chest, low oxygen, so he is not able to breathe. So physically this is how you will get the symptom. Tongue coated white with reddened papillae. Observatory symptom that you cannot miss in your case. Clear? Now, we call it a lot of medical terms that you'll find if you're reading Borik's Materia Medica, he use medical terminologies. If you read Kent's, he'll talk like a story. So, bringing all that together, asphyxia, that's how the patient will present with. It could be a mechanical. Why they are using the mechanical? Because something mechanical, he's not able to bring it out. That's where Antim tart can be applied. Remember, it is used as an emetic also in the past. Apparent death from drowning. We call that nowadays, what is it called? Asphyxia? Drowning asphyxia. Drowning from your own discharges in your chest, right? It can be used in that. Because he's not able to bring that fluid out, it can be used. From impending paralysis of the lung, sulkiness of the lung, let's assume. From foreign bodies in the larynx with drowsiness and coma. Always if you see these sentences that they write, paralysis of the lung with drowsiness and coma. When you say drowsiness and coma, like I said, Borik writes in more of medical language. In homeopathic language, with sulkiness. Child at birth breathless, asphyxia neonatorum, and relieves the death rattle. It says it relieves the death rattle. It may not be the complete remedy for cure. You may need another remedy as a follow-up in an acute case, but it takes care of the child. What is the unique craving for antimonium cap? Apples. I haven't got that in any of my patients because half the time when they are in distress, they are not going to tell me whether they love apples or oranges. But yeah, they have a craving for apples. This is their tendency that they have. So you may find a mother saying she only eats apples, nothing else she eats when she gets this problem. That is a very unique symptom for us. We can use that. So how's the child looking? sulky. Child clings to those around, wants to be carried, whines if anyone touches it, will not let you feel the pulse. Okay, so that's how the child is. Now, you will get the patient in different stages. You may get the patient like the video, where it's completely gone, or you may get a child who's little bit recovered because of antibiotics and come to your case, but still the child, mother will say, she's okay, the doctor said she's all fine now, but she's not completely okay. She still is not that kind of a child she was. She's still tired, weak and all that. So you may get in that state also, but the sulkiness will predominate the entire case of Antimonium tartaricum. Now, it's a very good emetic. So if vomiting is there, what kind of vomiting? This is related to the, not the respiratory, the gastric. Okay, one is respiratory, now gastric. Now let's say there is a sphere of action on the gastric part, and now the patient is developing vomiting. Vomiting in any position except lying on the right side. Okay, Nux vomica vomiting is there, ipecac vomiting is there, arsenicum is there, now antimonium tart. And he'll vomit until he faints, because already he is weak and tired. Already no oxygen supply, no circulation, nothing. Followed by drowsiness, prostration. Very, very important. A single dose after each attack helps to control the vomiting. Great sleepiness or irresistible inclination to sleep will be nearly in all the complaints. Drowsy. If you give that child now, just leave her, calm her down, she'll just sleep off. Because there is complete loss of oxygen levels, everything is gone. So they'll always be in a drowsy state. Like Nux moschata, like opium. But the reasons in opium, reasons in Nux moschata is different. But yes, sleepiness is like that. So, what are the aggravations? Number one, you already know, ailments from damp, moist, damp cellars, cold cellars. You can just name anything you want to in there. Dampness is the main thing. Change of weather will also come in this. So, if you are looking repertory and you're looking for ailments from change of weather in generalities, you'll find antimonium tartum will be there, pulsatilla will be there, but you know the difference between pulsatilla's change of weather and antimonium's change of weather reasons. Both are little different. Let's compare antimonium tartaricum and ipecac. Now this will be also part of your therapeutics lectures. Let's say we are learning internal medicine, we are learning about vomiting, causes of vomiting, clinical features, and then we are talking about therapeutics. We'll come back to this slide over there as well. So antimonium tartaricum, accumulation of mucus but lack of the reaction of mucus, hence scanty mucus. That is, he is not able to expel it out. Very little mucus may come out. Great accumulation of mucus with great expulsive power of the lungs. They both have accumulation of mucus. But ipecac, vomiting will bring out mucus continuously. But antimonium tartaricum, not able to bring out mucus, very little, because lungs is very weak. Lung does not have the power. Ipecac, nausea, incessant nausea, cannot stop the nausea at all. Antimonium tartum, no, even if that little bit phlegm comes out, he'll be okay. Something has come out, I'm happy. That is antimonium tartaricum. White coated tongue with red papillae. Ipecac, what is the tongue? Red, dry in the middle with thirstlessness. Very typical in ipecac. Acutely, if you have to look at a patient and prescribe, these are the three things that you look at if you are prescribing one of these remedies, comparative Materia Medica. Nausea relieved by vomiting. He's got nausea, I told you, even that little comes, he'll be very happy. Oh God, it's come out. Here, nausea will not end in ipecac. Vomiting will come, nausea. Vomiting will come, nausea. This is one of the frequent wrong prescriptions practitioners make. They give Nux vomica for the patient just because he's got vomiting. When there is incessant nausea, nausea not ending, whether it be pregnancy, whether it be indigestion, whether it be whatever, ipecac will score the highest marks even when you repertorize the case. Incessant nausea. Both will have pale face. That is not a very marked feature, because when you vomit also you will get pale face. When you are losing oxygen also you will get pale face. Covered with cold sweat. Very important antimonium tartaricum. So this is how you compare Antimonium tartaricum and ipecac. Now what I want you to do when you go home, I want you to compare Arsenicum album, Antimonium tart and Veratrum album. Okay. Now physically ipecac and antimonium tartum, sorry, not physically, mentally antimonium tartum is more sulky patient. There complete exhaustion, there is no way that he can react to it. He is more of nausea, that is much predominant. Okay, dosage. This is as per Borik's Materia Medica. So Borik is the guy who talks about more about the dosage because he gives more of physiological doses and sometimes dynamic doses. Second and the sixth trituration. He has started from second to sixth trituration onwards, you can go up. Predominantly in our clinic we give 30 potency that we could start with depending on the susceptibility though. Lower potencies sometimes aggravate. Sometimes. I have not seen aggravation, but yes, as per books it does say. For bad effects of vaccination, when Tuja fails and Silesia is not indicated, this is a red line. Bad effects of vaccination. So after vaccination, if the child develops pneumonia with a rattling in the chest, with a sulky state of mind, then you can definitely think of Antimonium tartaricum. That's why Antimonium tartaricum comes in your repertory. Ailments from vaccination, Antimonium tartaricum. But where? In the chest complaints. Before Silesia and dyspnea from foreign bodies in the larynx. Any practitioner you ask, foreign body, Silesia. But if it's a respiratory issue, even before Silesia, start with Antimonium tartaricum. But you have to be 100% sure it is a foreign body. You can't just blindly prescribe Antimonium tartaricum. Next is ailments from damp basements, you already know that. So that is the end of Antimonium tartaricum. So if you have any questions regarding Antimonium tartaricum, let me know and try to finish the, tomorrow we'll discuss about the comparison of those three remedies, write it in a paper and bring it and we'll discuss that in the next class. Anything else that you need?